All right, welcome to The Explainer. Today, we're jumping right into a real medical mystery. We're opening a case file on a cancer that, well, it pretty much breaks all the rules we thought we knew.
You know, we're all taught the same thing, right? Check for lumps. That's rule number 1 for breast cancer. But what if the enemy doesn't follow the playbook? What if it never, ever forms a lump?
And that question, well, it brings us to today's suspect. A surprisingly common but incredibly sneaky type of breast cancer. This one is a master of disguise, specializing in hiding in plain sight. So let's put a name to this culprit: Invasive Lobular Carcinoma, or ILC for short. Now, this isn't some super rare thing. It's actually the second most common type of invasive breast cancer out there. We're talking about a pretty big slice of the pie here, accounting for up to, say, 1 in every 7 cases.
Okay, but here's the twist. This is what makes it such a mystery. See, unlike most cancers that build a nice, hard, detectable lump, ILC just doesn't. It grows in this slow, kind of insinuating way that lets it fly right under the radar. It can dodge detection by touch, and sometimes even our best medical imaging can miss it.
So you've got to be asking, how in the world does it manage to be so stealthy? Well, to figure that out, we need to look at its MO, its unique biological fingerprint. The whole secret boils down to one key protein, E-cadherin. Now, you can think of E-cadherin as the cellular glue, or maybe Velcro, that makes cells stick together to form orderly tissues. It's what keeps everything in line. But here's the thing about ILC cells. They don't have it. It's just gone. And without that cellular glue, what happens? Well, the cancer cells can't clump together. They don't form a solid mass. So instead of an invading army marching in formation, they just break ranks. They go rogue and start to infiltrate. Exactly. It's not a frontal assault. It's more like a covert operation. These cells line up and march in single file, weaving their way through healthy tissue like little spies. And that classic single file pattern, that's the smoking gun that pathologists look for under the microscope. So this totally changes what you're looking for, right? The first clues often aren't a lump at all. Instead, because of all that infiltration, you see these subtle changes. Things like the skin getting a little thicker, maybe some dimpling, or even, as you see in this image, nipple inversion.
Okay, so with a culprit this sneaky, where do doctors, our medical detectives, even begin the search? Well, they start with the standard tool in their kit, the first line of defense. And that tool is mammography. It's the absolute workhorse of breast cancer screening. But here's the problem. Since ILC doesn't form that dense lump, a mammogram can have a really tough time spotting it. Its sensitivity, basically how good it is at finding the cancer, can drop way down. We're talking it could miss the cancer completely in up to 4 out of 10 cases. That's a huge blind spot. And take a look at these images. What's so wild is that to you and me, and honestly, sometimes even to a trained radiologist, these mammograms look pretty normal, right? There's no big, obvious mass screaming cancer here. And yet, the patient who had these scans did have ILC. The cancer was there the whole time, just hiding in plain sight, deep within the tissue. It really just goes to show you how tricky this can be if you're only relying on a mammogram. Okay. So the detectives need to bring in another tool, and that's where ultrasound comes in. It's a lot more sensitive for ILC, it's way better at picking up on these subtle patterns, and crucially, getting a much better idea of how big the tumor actually is. So what does it look like on an ultrasound? Well, it often shows up as this irregular, kind of shadowy mass. The technical term is hypoechoic, which just means it looks dark on the screen. But the bottom line is, it gives doctors a much stronger, more tangible clue to go on. But even that isn't always enough. To really see the full picture, to understand just how far this infiltration goes, and to plan the absolute best treatment, the investigators need to pull out the big guns, their most powerful tool. And that tool is the MRI, magnetic resonance imaging. For ILC, the MRI is just incredible. It has a sensitivity rate of around 95%. That makes it the absolute gold standard for tracking down this particular cancer. And this slide right here, this is the aha moment. This is the big reveal. Look at the mammogram on the left. You see a tiny, subtle hint of something, a little asymmetry. But then you look at the MRI on the right and wow, it just unmasks the whole thing. It shows the true, much, much larger extent of the cancer. It is a total night and day difference. And listen, this isn't just about getting a clearer picture for the sake of it. This clarity is a total game changer. For half of all patients with ILC, that's 1 out of every 2, the information from the MRI actually changes their treatment plan. It helps surgeons know exactly what they're dealing with, making sure they get all of the cancer out.
So what's the big lesson here? What's the takeaway from this whole detective story? It's pretty simple, really. When you're up against a target this stealthy, one tool just isn't going to cut it.
You need a combined approach. That's where the power is. The mammogram might give you that first subtle clue. The ultrasound comes in to help define it a bit more. But it's the MRI that really lays it all out, showing you the full scope of the disease. Each tool has its own job, and they all work together.
And this is what doctors call a multimodality approach. It's all about using these tools together, in concert, to find the cancer, define its borders, and map it out perfectly. So there's absolutely no place left for it to hide.
And that really leaves us with a final thought, doesn't it? This whole deep dive into ILC, it just proves that diseases don't always play by the rules we write in our textbooks. It really makes you wonder, what's the next elusive condition out there hiding in plain sight? And what new technologies, what new combinations of tools will we need to finally unmask it?